Hello, my name is Mark Pernik. I'm a neurosurgery resident at University of Tennessee in Memphis and Sems Murphy Clinic, and today I'm going to be talking to you about the incidence and severity of postoperative dysphagia after anterior short segment cervical fusion, corpectomy, or arthroplasty. Quick background, dysphagia is the most common patient-reported complaint after anterior cervical spine surgery, and EAT-10 scores are a validated 10-question questionnaire that rate the severity of dysphagia. And so our goal of this study was to compare the incidence and severity of dysphagia after short segment anterior cervical spine surgery, particularly arthroplasty versus ACDF versus corpectomy. So the methods we used, this was a retrospective analysis of a large multi-institutional dysphagia database that looked at elective anterior cervical surgeries between 2016 and 2023. We had 1,466 patients who qualified to be in this analysis. The overwhelming majority were 1 to 2 level ACDFs. A smaller group was single level corpectomies, and then 1 to 2 level cervical arthroplasties. We measured dysphagia incidence and severity at baseline, 1 month, 3 months, and 12 months postoperatively. And for statistics, we used an ANOVA to compare these three groups and chi-squared. And we also did a mixed effect Lis-Dichtix regression as well. So firstly, the results looking at the incidence of postoperative dysphagia at each time point. At 1 month, you can see dysphagia is very common between all the groups. ACDF and corpectomy both being almost 60% and arthroplasty at 40%. And there was an overall effect in this group, with ACDF being significantly higher incidence than arthroplasty. At the 3 month mark, dysphagia incidence tends to go down a bit, followed by the 12 months. At 3 months, there was an overall effect as well, with corpectomy having significantly higher dysphagia incidence compared to ACDF and arthroplasty. And at 12 months, there was no overall significant effect between the three groups. And then looking at this next figure, we have the mean looking at the severity of dysphagia over time. And again, in this figure, the corpectomy is dictated in the orange, or ACDF in the blue, and then the green with arthroplasty. And again, in this figure, I think it's easy to see that in the 1 month time point that dysphagia, is very common and it can be the most severe for patients, but then after that time point does fall off. So at 1 month, there was an overall significant effect, with ACDF being significantly higher than arthroplasty. At 3 months, there was an overall effect as well, with corpectomy having the highest rate of all groups, followed by ACDF and arthroplasty. And at 12 months, there was no overall significant effect. And then when we looked at things with a mixed effects regression model, you can see that corpectomy does increase the odds with an odds ratio of 2.3 at 3 months of having dysphagia. And then the most strong predictor, though, of postoperative dysphagia between all groups was the presence of baseline dysphagia, which I think makes sense. So conclusions, dysphagia is very frequent after short segment anterior cervical surgery. Arthroplasty shows the lowest unadjusted risk of dysphagia, and corpectomy confers the highest midterm dysphagia risk after adjusting for covariates. And as always, when you look at a patient who might undergo anterior cervical spine surgery, you should always consider their baseline dysphagia and other factors when framing expectations. Thank you.
Hi, Mark. Thanks to the program committee for an opportunity to discuss this important study. Post-op dysphagia is something that we get so frequently in our practices, and it's something that I think we need to find a way to get better, or a way to study it better, and this is a step moving in that direction. That's my new place. I moved to my hometown in Summit, New Jersey. I'm not up in Montclair anymore. Disclosures that I don't think are applicable. Post-op dysphagia, it's a very difficult subject to analyze. It virtually occurs in almost all anterior cervical surgeries to some extent. Numerous grading systems have attempted to make objective assessments of a mostly subjective complaint. In this study, patients were assessed after 1 or 2 level ACDF, corpectomy, one level corpectomy, or 1 or 2 level arthroplasty. There were 13 sites, 391 patients. They use the EAT-10 scoring system, which is a known and validated system, patient-reported, defined as greater than or equal to 10 to be dysphagia, and they assessed at 2 weeks, pre-op 2 weeks, and 1, 3, 6, and 12 months post-op. Unfortunately, I didn't receive any statistical data or analyses. I just got an abstract without any real specific data for me to analyze, so it's going to limit what I'm going to be able to report on here. But dysphagia typically occurred in about a third to half of patients at 2 weeks and essentially resolved by 3 months. Severe dysphagia was also uncommon. The data presented here appears similar to other published studies on this topic and to my own clinical experience. Smokers, females, and older patients had a higher risk of dysphagia. I think the authors should be encouraged to provide the data and statistical analyses, which the author did present, to be fair, right now. I just wasn't provided to me ahead of time, to allow more detailed assessment of their study. Thank you.